Live from Philadelphia, this is Good Day.
We're getting close.
It is 7:42. Jen Frederick has some fun stuff for you today. Hi, Jen.
Hello. Okay, see this right here? This is an example of a good facelift. But there are plenty of examples of bad facelifts. Kenny Rogers, Joan Rivers, Bruce Jenner. So we're going to talk a little bit about what they're doing differently. And by they, I mean Dr. Bloom. And we have a lovely patient here. She's going to help us out with all of it. So come back after the break. And by the way, she looks refreshed, doesn't she?
It is 7:49. We have seen the celebrities who have had, well, bad facelifts.
I think sometimes they just go too far or something like that.
But you think about Meg Ryan?
She regrets it. She admits it, right?
That's right. How about Lisa Rinna with her lips?
So here's the thing. Jen is going to make everybody happy today. You're in Ardmore with Dr. Jason Bloom. He knows how to do it where it just looks natural, right?
That's what we're talking about. Good morning to everyone. Good morning to you. Good morning to you. Nice to see everyone. So let's get to the naughty stuff first, okay, Dr. Bloom? Gotcha. Let's talk about a bad facelift. And one of the ones that people look at all the time, bless his heart, is Kenny Rogers. And I think everyone liked how rugged and manly that he was. You look at this, and you mentioned it, and it opened my eyes. You say he looks a bit feminine.
Absolutely. I think with his lift, he has a lot of taut or tight skin. It's pulled and it's kind of like swept up. So it changes the look of his eyes and it looks female.
Yeah, and one of the things we always say is like, man, they pulled that skin right up. That's what they used to do. Right. Nowadays, you have a new thing. It's called facial planing. It's difficult to understand and digest, but you're going to break it down easy for us. Basically, what you do is you go in and you release some things within the muscle layer, correct?
Right. This is a technique called a deep plane facelift. What I'm doing is actually taking the muscle layer of the face and actually resuspending it, releasing it first from its underlying attachments to the bone and the skin, and then resuspending it to a higher, more youthful position.
Okay, and so this young lady has not had anything like that, but you're going to show the beginning of what it could look like when you might think you might want to have something like that, right?
Exactly. What happens is as we age, you have this tissue in the cheek mound here, and what happens is there are some ligaments that are connected to the skin and the underlying bone that remain connected here, both here and here. As the skin and soft tissues of the face begin to fall, it creates these lines here and lines here.
You're still looking good. You're good.
A little bit of jowling as well in the lower face, and some laxity or looseness in the neck.
Okay, and so what you would do is you would go under there and release that so it's not connected, and then you could move with the muscle, not with the skin.
Exactly. So rather than just taking this skin or muscle and sewing it back, you first need to dissect all the way out to these muscle attachments deep to the bone and skin, and then release them before you resuspend or put them to a more youthful position.
Do you think people are going to start doing that thing more than the other thing that you guys were doing before?
Well,
that's medical talk there.
Well, the issue is that some people are worried about that because it takes a little bit more time, really good knowledge of the anatomy, and you know, some people want a kind of a quick fix, but this is a lasting result. In my opinion, patients want results. They want to look natural, and they want it to be long-lasting.
Okay, so real quickly, you're going to do something else for this young lady because she is not ready for a facelift, but she wants a little bit of rejuvenation. What are you going to do for her?
So one way that we can get by this is to camouflage these things. So what we're going to do is use some fillers, facial fillers, and put fillers in these lines here. She came to me and said, I'm beginning to look like Howdy Doody because we call these marionette lines, exactly. So what we're going to do is put some fillers in these lines in order to camouflage this and make it look better. So she doesn't need, you know, a facelift. This is kind of minimally invasive stuff we do.
Okay, cool. So we're going to see it at 8:45. Thank you for being our victim. I mean, patient.
Yeah. Needles.
So, Mike, you won't see anything until an hour from now, and then we'll show the before and the after.
Oh, so we can see it before the show is over, the results.
Yes, of course.
Oh, my goodness.
Okay.
All right.
Yeah.
It's Howdy Doody time. Thank you, Jen. It is 7:50. Save the cow today.
All right.
I want to get rid of these marionette lines that
Marionette lines. So, Jen Frederick, you may save a face, but I saved a cow.
We'll take care of it.
They just said, Jen Frederick, you may save a face, but I just saved a cow. I think a face is more important. or equally as important.
Well, okay.
So first of all, can you say hello? Look into this camera. Look at her. This looks amazing. And Dr. Bloom did this in 15 minutes.
So close.
Okay, let's do the before now, shall we?
Sure.
And let's talk about what you saw initially that led you to believe that this is what was right for her.
Well, what we decided was that she really was annoyed about these marionette lines, as we call them. So I used actually a couple different fillers based on their properties. So one is more like a gel that gives you a little bit more lift, and I put that in deeper, and then I used almost a thick syrupy type filler to use as a top coat for the small little lines.
It took 15 minutes?
Yeah, about 15 minutes. How'd it feel?
Do you want me to tell I hate needles.
Yes.
I could never have been a junkie. I hate needles.
Okay.
But it wasn't that bad. I'd do it again.
You like how it looks?
Yeah, I think it made a difference.
I think it makes a big difference.
It's not, you know, like huge, oh my God, what happened to you?
Right.
But it's, yeah.
I have to tell you this. When we talked about doing this segment, I know a person who is young, and she had something like this done, and she looked fat afterwards.
Right.
I hate to put it that way, but her face looked puffy. You
Does
just
mine look puffy?
No, you look like you just had some kind of awesome makeup or something. I think her friends are going to say, what kind of makeup are you using? Are you having a new fruit drink or something?
Exactly.
You look rejuvenated but not fixed.
It's like the subliminal kind of reactions that you'll get. This is natural, and I think it's rejuvenating. It's really nice.
And how long will that last?
About 6 to 9 months. Fillers in certain areas kind of break down a little bit faster, but she'll get 6 to 9 months out of that pretty well.
And it'll be like, it's not like all of a sudden whammo. It'll be like a slowly,
Exactly.
She'll be able to see it a little bit at a time.
Exactly. It's more of a gradual breakdown of the filler.
And
back to howdy doody.
No. And do you put in less next time because she already has some, like how does that work?
There has been some research, actually, this was a few years ago, saying that by stretching the skin, that the cells actually produce collagen. So you could actually need less filler the second or third time rather than the first.
Okay. You look amazing. Congratulations.
Thank you.
And if you're her girlfriends, you're going to be jealous. Mike and
Jan?
Chanel, now here's the thing. Yes, sir.
I got to tell you this. We ran the video from the hour before you did the fillers.
Yeah.
This looks fantastic.
great.
It went
I
away.
know. She came out, and I was like, I expect great things from you. I'm not saying that I'm not expecting, but doesn't it look really good?
It does.
It looks a lot better. I think the whole, it looks natural. It looks like it belongs on her face. Is that a weird thing to say?
No, it looks
I mean, it looks
natural.
like you had some kind of superstar makeup treatment as opposed to
How much is
the
it?
fine. How much is it?
It's started around $6.25 a syringe.
But listen, we're paying $150 for some dumb facial that doesn't do half.
That's
right?
true.
You're right.
The last
You're right.
9 months.
This lasts.
Not to do a commercial, but I have to say, it looks really, really good.
Thank you.
Looks like she
Congratulations.
just had a long spa retreat vacation.
We all on
Yes.
vacation.
Yes.
Good stuff, Jen, today.
Hey,
hurt
coming
that
up, we're
syringe
going to
in your
get your hair
face.
free.
Okay, cool.
Okay.
We're going to take your hair off.
Wow, that
Next
was-
hour. We are givers.
And we're honest. We'll say if it didn't look like it was worth
yeah.
it. That was,
They went away.
it was gone.
It's gotta hurt though. What would you do if there was no? Just not there
I want
yet.
to meet Nellie.
Okay, Nellie. But first off, we got to take some hair off of a man, even though he has no hair. Jen's gonna find some hair. I bet that she can remove from his body.
Now, Mike, we've
Yes.
gone over this before. What happens is they shave the hair off
All
before
right.
they do the lasering. So before, he was a hairy beast.
Yes.
Now, he's not so hairy. And what they're going to do is they're going to do some lasering. Now, let's introduce everyone that's here. This is
Okay.
Dan, our victim. Dr. Bernstein, good morning to you.
Good morning.
And, of course, Amber Joy. Now, why is Amber Joy here? Why is Real PA Miss USA here? Because you just did this. What we're talking about, it's a laser that goes twice as fast as anything you've ever used
It
before.
is super, like a Ferrari.
It's a Ferrari. And
It's
you can
fast.
do all kinds of different skin tones. So you literally just use the same machine on Amber Joy.
Right. It's 2 lasers in one. So you got the one for my skin tone and for darker skin tone.
Okay, and you've had hair taken off before. This was different how?
It was just rapid fast. It was like 2 minutes. So people always complain about the pain, but it's so quick, it doesn't really, it's so worth it.
Okay, she's got a smile on her face. Let's see how Dan does. So you're going to take some hair off of him. And again, Lisa had said that sometimes it can take an hour and a half, 2 hours to do someone's back like this.
Right.
But with this type of laser, it's way faster.
It's way, 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 way faster.
Yeah, we're ready.
In fact, I think we'll be looking to go to the Guinness Book.
Really?
I'm serious.
And he's not flinching at all.
Well, he's very brave.
Is it less pain, or is it just because they know it's going to go faster, they can like deal with it?
It might be both. The cooling's a little bit more efficient, but this laser is unbelievably quick.
Okay.
I mean, that's a huge spot.
And she's just going bam, 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 bam.
Exactly.
And so, will the hair not grow back as fast? How long will, if he gets this done today?
So we usually bring, after a back treatment, probably 2 months.
Yeah.
Probably bring him back in 2 months for another treatment. Usually get a series of treatments, and then kind of you're good.
Yeah.
Maintenance could be 6 months, a year, but it really works. And for big areas like this is huge. It used to take me like 3.5, 4 hours.
And you said the other thing is, a lot of times people might be tan, like on their legs, pale on their face. There's different types of skin color within one person.
Yeah, the biggest deal with lasers is treating dark skin. That means either tan or skin of color. And this laser has 2 wavelengths, 2 lasers inside basically. One for treating darker skin and one for treating people like me. So it's all in one. So you can treat every skin type.
Now, I was speaking with someone at your front office, and she said this is the time of year when everyone's thinking about it. So do you have to start now if you want to be hair-free?
Yeah, you have to start now. And it's like that with a lot of stuff we do with lasers. I want a tattoo off and get married Wednesday, no good. So you got to start now. And this laser, this is one of the first ones in the country. Like, you know, I call you when it's something brand new.
Yeah.
This is brand new.
And how is it so much faster as we wrap it up?
You know what? It just, the pulses come much like at double the speed.
Okay.
And it's just a design inside. The engineers are smart people. They designed it so that it's fast.
I love it. All right, well, thank you, Dan, for being our victim. You look adorable. Thank you, Amber Joy, for being our victim. Mike Jarek, we're just getting everyone ready for a beach-a-palooza here.
Hey.
I need the beach.
Yeah.
Some good-looking humans.
It's going to be warming up outside. Good stuff
They don't have
today,
ugly people
Jen.
coming here. Apparently,
no
you have to be
question.
adorable to come here.
Okay, fine. I understand
Thanks,
that.
Jen. Thanks.
Say hi to Amber for me.
Yeah, speaking of
9:48.
adorable.